here back with live from HMPS 2026 in Salt Lake City, and I'm actually sitting down with someone that I've known for a number of years, Aaron Patzer.
Yeah.
And you said you flew in here from New Zealand because that's
did.
where you live now.
Yes.
So apologize for the time difference, but I'm excited that you're here. Aaron, before we get started in today's conversation, you want to share a little bit about yourself?
Sure. I'm the CEO and co-founder of Vital.io. We guide 7 million patients through emergency, inpatient, urgent care, and surgery experiences in real time with major health systems. Before that, I was the founder of Mint.com and the head of product innovation across all of Intuit when I was like 29 or something.
I know.
It's crazy.
I mean, and Mint.com too. I mean, these are big platforms. And through these platforms, I think you've come to really understand how technology can be applied appropriately and used in certain ways. Today, we're going to focus in on a topic that is, along with other things like trust and et cetera, AI is just like, everybody has to say it. I think everybody's financially obligated to talk about AI.
Yeah.
But in our space in healthcare, I actually did a debate this morning. We have a lot of challenges around how AI is being developed and deployed.
Yeah.
We have to move fast, but we're, as a health industry in the United States, we don't move fast.
No.
I would say arguably that's a good thing, but I would also say that's also an inhibitor to it.
Well, the health industry thinks that they're keeping people safe, but by moving this slow, what they're doing is actually pushing people to all of the unsafe but much easier alternatives. So everyone is just pasting their medical notes into ChatGPT or Claude or Grok or Gemini. And the problem with that is those are totally unregulated, cowboy, winner-take-all, Wild West style businesses, and they don't really care about patient safety. There are no physicians reviewing the outputs of these models.
Right.
They're trained off of Reddit comments, among other things. And so if you want to test how bad it is, just say, what should I do for my lower back pain? And it'll say, these are the 3 exercises you should do. It should stop and say, hey, are you 90? Do you have osteoporosis? Do you have a lumbar fusion or something like that? It should refuse to answer until it gathers enough context about you. And so that's what safe AI should be doing.
Yes, okay, safe AI. I love that term because that actually is, safe AI doesn't mean that it's slow and over a hyperly regulated, but it means that you have to develop some standards around it. And that kind of led to the formation of your AI care, tell me the consortium name again?
It's just AICareStandard.com.
AICareStandard.com.
It is an industry consortium that we put together with leaders from HCA, MedStar, IU Health, Hackensack Meridian, a dozen other health systems, leaders from the Veterans Administration, AONL, Patients for Patient Safety. So it's got everyone. We actually invited big tech in there. I thought Microsoft and Amazon were going to join for a while, but then they said they needed to own the IP, and we wanted to keep this nonprofit for everyone. It's a set of tools that you can use to evaluate patient-facing AI. So that is AI that works without a doctor in the loop. These would be things like medical summarization or your medical GPT, where you can ask, what do my lab results mean? What could that mean? What dietary changes should I make? All of those things, health systems are like, whoa, there's no way we can put that out without a doctor in the loop. You can actually do this in a very safe way, but you need to go through effectively 10 principles and a checklist to make sure it's safe. So for example, what do you do when you have sensitive information? A medical note contains something like a loss of pregnancy or a new terminal diagnosis. What if there's suicidal or homicidal ideation? What if the patient has dementia? Do you stop the chat right there? Do you escalate to a human? That's probably what you should do. You delay it. None of those things happen with traditional big LLMs, but they're crucial for the safety and humanness. You shouldn't learn about cancer from an app. But that happens today with the 21st Century Cures Act. MyChart will release that data immediately. The only saving grace is no one's using MyChart in real time. It's like 6 to 10% of patients. But at Vital, we have about 60 to 80% of patients using it. And so we notice when we put doctor's notes out there, we've been doing what we call the doctor to patient translator for about 3 years. It was super valuable for patients, but there would be these questions. And so we were like, okay, we need safety checks. If there's sensitive information, we delay it by 4 hours or 6 hours, or we flag a doctor to get in front of, don't learn you have cancer from an
Right.
app. You need to make sure that your AI is trained on good sources, not Reddit, not the general internet. You need to make sure the AI can detect its own errors. And you might be thinking like, if an AI knows that it's making a mistake, why is it making the mistake, right? Obvious question. You actually can use a second AI to say, here's a summary of the medical information, here's the original note that it came from, what's missing, what's oversimplified, what are the crucial, and you can actually eliminate about 80% of errors and hallucinations. You can do tricks where instead of putting 100 pages of medical information in, you have pre-processing, so it's only the most relevant information about the patient, not all the cut and paste garbage that gets into medical notes. And that reduces number of hallucinations and issues. So you might say, well, what have you reduced it down to? We've gotten it to 99.8% safe and effective. And the last 0.2%, actually, when we dive in, it's almost always a human error. You see cut and paste errors in these medical notes where somebody's fat fingered it. They've used, they have these automated keystrokes where it'll fill things in. And so it says, I looked at the CT scan, there's no diverticulitis. And it says, there was a finding of diverticulitis. And you're like, okay, which is it? Or somebody's like, this person weighs 4,000 pounds. And you're like, probably not world record setting. They probably meant 40 or 400, depending upon the age. If it's a kid, it's probably 40. And they just added, you're missing a decimal point. The AI needs to be able to detect contradictions in its input data. You need to make sure you have physicians looking at the output on a regular basis. You need to retrain the model at least once a year to prevent what's known as model drift. Now I'm getting a little too technical. If you don't know what that means, we will educate you. And the whole point of the AI Care Standard is you should have your vendor fill this out. You shouldn't have to spend all of the time and money and put together your own AI committee at your own health system to do the work that the other health system is doing and the other health system down the street is doing. You should just have effectively like a stamp of approval from the vendor or a third party to ease the burden and so that it is possible to put out safe patient-facing AI. There's only a couple of tools out there that really abide by safe standards right now. All of the LLMs, I tested them. They do actually have some safety features in them. I will give them credit. They can detect suicidal ideation and whatnot. But they all rank exactly the same, which is not safe for patient deployment.
But didn't Gemini just put in its fine terms at the bottom? It says, don't use this for medical.
Well,
that work?
That covers it. I guess there'll be no more medical issues or problems now that they have that disclaimer.
Well, what's interesting about it is, we're talking right now in May of 2026.
Yes.
In January of 2026, the FDA lowered the guidelines for patient-facing AI. They basically are encouraging innovation. I'm not saying that's wrong, but that opens up a world now of how do we govern it? How do we understand exactly where we're at? Having a consortium like you could help with that, right?
Yeah, it's the industry in effect regulating itself or setting its own standards, and because it's got the backing of a MedStar, an HCA, IU Health, these big names, all of these experts that have come in. It's the best that we've got right now for patient-facing AI without a clinician in the loop, which I know scares a lot of people, but people are going to do it anyway with unsafe alternatives, and so you had better adopt this or you're effectively causing more net harm in the universe.
Because it could amplify these tools. They love to consume that data and then re-amplify.
And just to allay anyone's fears, we've been running effectively this standard ourselves internally on our own products since May of 2023. That's when we put out our doctor-to-patient translator. That will translate any radiology image. A radiologist will say, you have a fracture of the lateral and medial malleolus, and a normal person's like, I don't know what body part that is. And it translates that into, you have 2 broken bones in the foot. And so, or you have a cerebral infarction of the left hemisphere, and it says, your mom had a stroke, something a human can understand. We have run literally millions of radiology reports through this. We haven't had a single lawsuit. We haven't had any, any issues with it. So just, if you want empirical evidence, there are many big health systems running this right now. without the liability that your lawyer says is going to happen if
Right.
you do it right, if you follow this standard.
Yeah, I think that's incredibly valuable in this day and age where it's sort of a wild west with
Yes.
patient-facing AI tools. To have some kind of standard, I've always believed that the community should come together and create that standard.
Yeah.
It's great that you actually have put that into motion. So, Aaron, I really appreciate you sitting down with me for a few minutes and sharing this.
Thanks for having me, Chris.
Yeah, absolutely.